Patty Stalker here from WestfordCAT with my weekly Zoom recording with the Westford Health Director, Jeff Stevens, to just sort of give us an update on what's going on with COVID-19 and other things that are happening in town related to health and well-being. How are you, Jeff?
Good, Patty. How you doing today?
I'm doing good. I'm glad you were able to take a week off last week. We missed you, but I bet it was well needed.
Yeah, good and relaxing, but it's funny, the work's always waiting for you when you get back.
I know it doesn't, it just doubles. So, but at least you can attack it with a clear head.
Yeah, it's all good.
So I want to talk about a few things today. I want to get into the phase 3 reopening of Massachusetts. But first, I wanted to touch base on the numbers. In Massachusetts, I've been keeping an eye on the daily dashboard, and definitely the newly reported cases, number of cases has gone down. And now it's just flattening. And in other parts of the country, we're not seeing that. And I was wondering if you could give your opinion on why you think that's happening here in Mass.
Well, I can certainly try. Where I'm not a medical doctor, I still do pay attention to a lot of the numbers and a lot of the webinars and Zoom calls that I attend are based a lot of what's happening, as well as what the CDC has to say. And I think we've been very fortunate in Massachusetts where we have pretty much slow rolled our opening. And we've been sending a fairly consistent message on wearing your face covering, socially distancing, and washing and sanitizing your hands. And we've been kind of drilling that into people for the past almost 5 months now. And I think people really get it in this state. And I know there are people that have their own opinions on wearing masks and things like that, but we're in a position where we are still able to allow indoor seating in restaurants. We have sports teams that are now starting to play things like softball games and baseball games. We have teams practicing. Still, there's no full contact or high contact, high risk sports allowed yet. We're still waiting for that to open. But I think our numbers are staying low because people are fairly vigilant about what they're supposed to do. And the one thing that I just want to remind people and stress is we need to stay vigilant, and we still need to do these things, because just by keeping your hands clean and just by wearing your mask is, when you're out in public, is so important. And when you're wearing it, it's important that you're wearing it properly, where you've got it over your nose, covering your mouth. People that are wearing it like this, it's not doing its job, and they are not chin straps where you see a lot of people walking around. I know they're uncomfortable and they can be difficult when you've got glasses. They don't come off that easy sometimes, but they appear to be a very necessary thing that we still need to do. So I can't stress enough for people to keep wearing them. Any face covering is better than no face covering, but if you can get something that's comfortable, easy to breathe, and is offering a reasonable amount of protection, I think that is something we all just need to continue to do. And the other thing that's important, everybody, wash your masks on occasion. Get a couple of them, stuff that you like, and keep them clean, because if you are around a person that is potentially a spreader of the virus, you need to wash the mask, because if you touch the outside of it, you could potentially contaminate yourself. So it's important to properly don and doff your mask when you're wearing them. It's just really good, keeping your hands clean as much as you can. As far as our numbers staying low and in phase 3, I hope that we continue in this trend so we can make sure that some of the phase 3 openings, like the museums and outdoor venues and movie theaters, are able to continue to stay open and they can thrive. It's going to be important that we do those types of things as well. So I'm excited for everybody to be able to see just another step towards normal, but we still have a lot of work to do. This virus still has no vaccine, and it's going to stick around.
So speaking of phase three, fitness centers, movie theaters, museums, outdoor performances, batting cages, go-karts. So I'm assuming each one of those business sectors has a different sort of like guidelines to follow, correct?
Absolutely. So the state has put out on their website uh, each sector specific guideline for what those hygiene and safety protocols will be for whatever the event is. Some places may only allow 40% of their capacity. Other places may be operating at one person per 1,000 square feet with no more than 25 people inside at a time.
I
It will
notice
vary. It will vary depending on what you're looking to do.
I'm noticing schools too, as you know, some public schools still don't know what they're going to do. Some colleges, like the Ivy League colleges, are going to do just online classes. One of my sons is going to be sort of a hybrid, some online learning, some in-class learning. Quarantining the kids that are coming in from out of state for 14 days, trying to keep each kid in a separate room. But other colleges are just you know, business as usual with, three kids to a dorm room. So I guess we're just going to have to see how all these different schools handle it.
Yeah, and in Westford, I can speak only a little bit to that because I know Bill Olson and his team are working really hard to come up with a plan that makes the most sense for Westford. We've had a lot of meetings. There are teams that are dedicated to the reopening. There are teams dedicated to the layout. There are teams dedicated to safety and sanitation with the nurses. And the plans that we're waiting for still, there's still information from the state that we need to pull these plans together to make sure that we're going to do the best and safest thing for the students and for the teachers too, because it's their safety as well and the rest of the faculty and staff. So we need to make sure that we're not putting anybody in harm's way and reducing the risk as much as we can. So it's a pretty massive undertaking.
I was going to say it's a big job and a lot of responsibility. A lot of minds have to come together. A lot of information needs to be studied. So I'm glad to hear that Westford is taking it seriously. That's good to hear.
Yeah, they definitely are.
So speaking of Westford, what are the numbers looking like in the way of new cases and active cases in the town?
So what we have right now is we have hit 150 total cases in town, and we've got 135 people that have recovered, and currently we have 2 active cases. Uh, I don't know if we'll ever get to zero. It would be great if we did, but at this point, we just wait for people to recover or have people uh, report into the Maven system that become infected. Like I said, until we have a vaccine, it's kind of always going to be here. I mean, we have the ability to control the spread, and I think we've done that, and we need to continue to do it. There's a couple of examples that I could give of where, if we don't control it, we could see further spread. And one is I'm not going to name the towns, but there are two specific towns in Middlesex County that have both quarantined their football teams. They were doing drills. They were not, they didn't have any hand sanitizer around. They were not socially distancing. A couple of students on each of the teams were infected. And because these kids were so close together for a period of 15 minutes or longer at closer than 6 feet, the entire teams were quarantined. So that doesn't mean all 50 kids are going to have COVID. It just means that when we don't socially distance, more people get quarantined, which kind of throws a monkey wrench into the works. And all of a sudden, a lot of things grind to a halt. Another example that I have some firsthand knowledge in is a restaurant where one infected worker worked for 2 days before he found out about it. And he immediately went to his doctor, got a test, found out he came back positive, and 23 of this restaurant's 31 workers all now need to be quarantined. And that restaurant then needed to close for 24 hours. They brought crews in from another facility just so they could open back up in another day or so. So it's something that we all need to still socially distance and pay attention to. If we do it, we have less instances of people becoming ill and less chances of the economy being impacted, because now there's 23 people that are out of work for 14 days. And that's all stuff that people need to take into consideration when they're not out wearing a mask and they say, oh, well, I don't need to worry about this. Well, you do, because we all have a responsibility to each other.
I know that some people have asked, when you're outside and socially distanced, do you still need to wear your mask?
So the governor's orders actually say that you need to wear your mask when social distancing outside is not possible. So if you can socially distance outside 6 feet or greater, you actually don't need to wear the mask. There are some sector-specific things that still require it for a certain business, and that's something that needs to be taken into consideration. But if you're walking outside with your family or you're with a friend and you are 6 feet apart, you don't necessarily need to have that mask on right there. But if you cannot maintain 6 feet, you need to wear it.
What about on the flip side? What if you're outside, both wearing masks, sitting together?
You should still socially distance when you can, because the mask itself is not a preventer of COVID. It is merely a barrier that helps prevent. So by wearing a mask does not stop you from getting this. It reduces your chances. If you both have it on, the chances go down, but that's why we're wearing them. If you were around somebody that was COVID positive and you still had your mask on, you are still going to have to quarantine or isolate depending on your situation. You're just reducing your chances that you will be sick.
Thank you for clarifying that, because I've heard debates all over the place on that with being outdoors. So thanks for that clarification, Jeff.
Not a problem.
So you said that you had wanted to talk a little bit about Triple E.
Yeah, I just want to keep reminding everybody in town that Triple E has now been found in the western part of the state, specifically in Athol, which is really not that far away. It's maybe an hour, but when I drive home, that's not that far for me. So if it shows up there, it's going to show up in other parts of the state. Additionally, West Nile virus has shown up in Middlesex County. I want to say the town was Medfield. So that's now shown up in a mosquito there. So these mosquito-borne diseases are now active. And now we are doing full surveillance through our Mosquito Control, as well as the state. So it's really frustrating for a lot of people that, okay, you have to worry about COVID and we're worrying about sun safety and now you got to wear bug spray. There's a lot that we need to do, but all of these things are unfortunately really necessary, because West Nile virus is not exactly a pleasant virus for humans to get, and Triple E can be debilitating for your lifetime. It's really dangerous. Not a lot of people get it, but it's out of, I think, 138 people have had it, and I'll have to check that number, so don't quote me on it. Many of the people have lifetime struggles once they get it, and it does take the lives of people that are immunocompromised. So we need to pay attention and be ready for it. Long sleeve clothing at dawn and dusk, bug spray whenever possible, 30% DEET when you can. If you'd like to use some of the other organic methods, that's fine, but I recommend DEET. I feel that DEET does the best job based off of what I've seen, and to me, I don't know why anybody use anything else when we're talking about a potentially deadly mosquito-borne illness.
As the summer wears on, we can keep an eye on Triple E and West Nile virus during these updates.
Yeah, as we move into this season, I will make sure that on our website and on our Facebook page that if there's any relevant data that people need, I'll make it as accessible as I can. On the Facebook page, If you scroll through, you'll actually see that there's a schedule for mosquito control when they spray. I've got the July schedule up there. I do have it on the website as well. And if you would like mosquito control to come to your neighborhood and spray, you can go onto their website, you can log on, and you can request that they treat your neighborhood. They come, I think it's twice a week that they are in town, and they're happy to treat a specific area.
Can't they just do your yard as well? I remember them doing that. Just
Yes, they
just the woods on my property.
Yep, they can treat one specific yard as well.
And it's free. Let's let people know it's free.
Well, we're all paying for it one way or the other, but
it's not an extra fee.
It doesn't come out of pocket.
Okay.
For sure. Conversely, if you are a person that does not want your yard treated, there is an option for you to stop treatment as well. So if you don't want your area sprayed because you feel strongly that you don't want that treatment there, they won't do that. So it works both ways. You can prevent them from doing it as well.
That's great.
So, some other things that people can do, and believe it or not, they're really, really critical, is making sure you're going around your yard and making sure you don't have standing or stagnant water anywhere. If you leave standing or stagnant water, it's amazing how fast mosquitoes will immediately gravitate towards it and breed in it, and it doesn't take long.
That could be a sand bucket. It could be an old planter. Things along those lines.
It could be anything. It could be an old tire. Maybe you've got a couple tires in the backyard from the lawnmower, and there's water that built up. They love those things, and those are all things that just will increase the mosquito population. So if you can get rid of those and make sure tires are empty and standing water, and maybe a tent you have in the backyard where you got to drain the edges, or if you've got a small kiddie pool, make sure it's turned over. If you've got a full-size pool you don't use that much, get some aeration into it or get the pump running. The mosquitoes don't like moving water. They need stagnant water. So those are little things we can do to help keep that population down.
And again, so people can go to your website, which would be westfordma.gov, and then search for the Westford Health Department. And then what about your
Health Department?
That's okay. And then your Facebook is Westford Health Department?
Yeah, I think it's at Westford Health.
Okay.
The actual.
And there's ticks too. So here we go.
Yeah, we've got ticks out there, and there's plenty of them.
Yeah, there's sure. I see a lot of deer, so there's definitely a lot of ticks.
Yeah, there's no doubt. And it's one more thing, when you're out in the woods, make sure when you get home, check yourself completely. All folds of skin underneath places where ticks are going to go. They're going to go to dark, warm, moist spots, and sometimes you don't see them.
No, they're tiny too.
Yeah, and you only notice when they've had a meal. Right?
That's the truth. Okay, Jeff, well, thanks for this update. We missed you last week, and we'll plan on checking in next week. And
Right,
we really appreciate your time. I know that you were really busy this week getting back to work, so thanks for your time.
Anytime. Glad to be here, Patty. Thank you.
For WestfordCAT, I'm Patty Stalker.